Welcome to Support for You and Your Child with Hearing Loss, a Q&A with CHC's Pediatric team. I'm Lori Hannon, the Executive Director at the Center for Hearing and Communication. CHC is a private, not-for-profit center for people of all ages, with all degrees of hearing loss. A particular expertise of ours, however, is the work that we do with children who have hearing loss. Tonight, you'll be hearing from some of our pediatric team, including clinicians from audiology, speech pathology, education, and psychology. At CHC, we pride ourselves on a multidisciplinary approach, and hopefully you'll see some of that in evidence tonight. Now, before we get started, I'd like to introduce all of our panelists. We'll take just a minute as everybody shows up on our now familiar Zoom screens. Hi, everybody. I will introduce everybody in the order I see them, which may be different from you, as we all now know from Zoom. So when I introduce you, please wave so everybody will know who you are. First, Camille Mihalik, who is our Director of Communications, a speech-language pathologist. Next, Michelle DiStefano, waving, excellent. See, everybody really listens, it's wonderful. Michelle is a senior audiologist in the audiology department at CHC. Next, Dana Selznick. Good wave, Dana. And Dana is a teacher of the deaf and director of our education center. Elizabeth Rourke is the assistant director of our communications department, a speech-language pathologist. Anita Stein-Myers, our assistant director of our audiology department, and of course, an audiologist. Jane Oriemo. Jane is an audiologist. Did you wave? Okay, good. Everybody's got to wave. Jane is, they have to know how friendly you all are. So Jane is an audiologist. She is the clinical supervisor of our interns and our fellows in the audiology department. And Dr. Sandra Clough is a pediatric psychologist and psychotherapist in our emotional health and wellness center. So we're very excited to have everybody here today, and we'd like to get started with questions. We have some questions that have already come in, and I'd like to call up first Jane and Dana. Okay, great. So Jane, maybe you take the first part of this one. A question came in. My child is 7 years old, has a hearing loss. He does fine in school except for reading. Does he really need a hearing aid? His audiologist says he does.
Great question. In order to learn to read, children need to be able to associate the sounds of speech with the symbols involved in the written word. So this includes even the softest sounds of speech. So yes, definitely, if hearing aids were recommended, this would be important for the child to learn to read. One example is the S sound. It's very soft, but it has applications in terms of meaning, for example, single versus plural. And Dana can talk more about that.
Absolutely. I completely agree with Jane. And this is a question that we get often, especially with unilateral hearing loss. But when I speak to classroom teachers about certain children that parents do have this concern, the teacher often says that when the child is wearing their hearing aid, they notice the child being able to articulate the sounds that, like Jane said, a plural versus singular word, and it helps them to really understand the full meaning of what they're reading. If some of those sounds are left off, the child often gets confused. How many people am I reading about? Or, just various details about the story. So it absolutely helps, especially for early readers. When we're teaching just phonetically the sounds of each letter, a lot of the sounds sound similar. So if we're expecting the child to be able to know that, an S says versus an F says, they can sound really similar. So making sure to have full auditory access is very helpful.
Okay, great. I think that's really helpful. So I love to listen to both of you, but you guys will go away now. And another question came in for Anita and Camille. I think would be good to address this. And we'll probably see Camille pretty soon. Camille, can you turn, there we go. There we go. So a question came in, and this is now about a much younger baby. And Anita, maybe you want to take this first, and then Camille, I know you'll have a lot to say about it as well. A parent wrote in, my baby's just 5 months old and has a moderate hearing loss. Does he really need to wear hearing aids? And does he really need to start therapy right away? Or can we just wait until he's older? So maybe Anita, if you would address the hearing aid part of it, and then Camille can take over that.
Okay, thank you for that great question, whoever sent that in. I think it's very critical for infants to begin the process of learning to listen with their hearing aids on, and to begin the process of learning to listen with a speech language pathologist. Interestingly enough, we actually all start hearing before we're born. When a baby is in utero, their inner ear is typically working to some extent, and that early listening and that early connection between the ear and the brain plays a very important role in keeping the brain stimulated, in particular, the listening centers of the brain. So it's almost like building a house. The foundation of the house has to be very strong. And in order for the foundation of the house to be very strong, we have to build from the bottom up. And from the bottom up, for a child who needs to be wearing hearing aids, is starting early. Their brain will learn to hear, and the process of learning to listen will follow.
Great. Camille, can you offer your advice about therapy? I know a lot of times we hear people say they're so little, why do they need to start therapy? They don't know how to talk. Nobody at 5 months knows how to talk.
Exactly. So many parents, even teachers, think that they don't need therapy really until they're a year, maybe 2 years old. But to piggyback off of Anita's wonderful analogy about building that house, if I look at that house as a child saying words and understanding words, so much goes into building that house before they're there. And we don't expect first words until around a year old. But so much happens in learning to speak way before there's an actual word. There's first cooing, then babbling, and then finally those first words. That house doesn't just appear on their first birthday. It really needs a lot of building and construction and so much listening that needs to go on before you have that end product of a child who can speak. And from my experience, if I have a hearing impaired baby in my practice who started therapy right when they got their hearing aids, hopefully at just a couple of months old, there is a stark difference between a baby whose family decided to wait until they were a year old. There's so much more catching up that we need to do in that case. So really earlier is better. I think when we're talking about all things hearing, wouldn't you agree, Anita? Earlier, the better. It's hard. I can't think of a situation where it's maybe not appropriate to do it sooner.
Always, yes, agreed.
I think those are great answers. And I can understand the parent's point of, a baby not really hearing or talking before then, but I love the fact that they're sitting and listening, and I think you explained that really well. And I hope that the parent who asked that question gets some good information about that. Thank you very much. A question came in a little bit that's really relevant, probably because today is so hot and humid. And Michelle, I think this might be a good question for you. A parent just asked, and I have to believe that today's temperature had something to do with it. They want to know, how do you take care of hearing aids in hot, humid weather if you don't have a drying device?
If you don't have, well, first you really should think about getting a drying device, especially the way the humidity has been. And also many drying devices now are also cleansers. They can actually use some UV light and make sure that there's no bacteria on the hearing aids, which is very important now as well. But the main thing to consider is if your child does sweat a lot or accidentally runs through a sprinkler, some hearing aids are slightly water resistant, but they are never waterproof. So you want to remove the hearing aids as soon as possible if they do get wet. You want to try and take the ear mold off the hearing aid, open the battery door, and leave them in a dry, cool place to try and dry out overnight. If you notice that the hearing aid has any moisture in the battery compartment or has any moisture building up around the edges of it, you can actually wipe it down with a dry cloth just to make sure that you get any excess moisture off of it. And you can also make sure that the battery contacts are clear. Sometimes just using an ear mold blower, which is a little squeezy that blows air, will allow you just to blow some extra moisture out. The important thing is you don't want to put it on top of a heat source. You don't want to blow dry it. You don't want to put it in a microwave. We've had people do that. And if you see that it still isn't working, contact your audiologist, because sometimes it's an easy fix in the office.
Okay, great. And Michelle, if you would just stay up, because now that it's the beginning of the summer, another related question came in. And Anita, if you could come back on. And just, maybe just to let everybody know, just a reminder, if you have questions, put them in the Q&A. Yep, and some of you are already doing that, but don't be shy. So kind of a related question came up. How do I prepare for summer camp in terms of my child's hearing aids? And I don't know if it's, if you want to address whether it could be, sleepaway camp, or day camp. Are there, maybe Anita, do you want to give some pointers? And then Michelle, you could, add things that you could think of.
Well, I think to add to what Michelle said about using a form of a desiccant or an electric dryer or a portable plastic or glass tub dryer, those are things that should accompany the child to a sleepaway camp. But day camp and sleepaway camps, regardless of a child using hearing aids or cochlear implants, I think one of the key things is to make sure that a parent or caregiver provides some instructions to a counselor or a nurse at the camp so that they have some familiarity with hearing equipment, know how things are being used, and if it's a younger child, knowing how to troubleshoot them if the child isn't independent enough to do that. But making sure that there's extras of everything, even if you don't think that you need it. So the drying kit should always accompany, but extra batteries or rechargeable batteries, depending upon the hearing device the child is using, sweat bands or pieces of equipment that can help reduce moisture from building up on hearing aids. There's a number of different commercially available products. One that comes to mind is ear gear, which is a neoprene sleeve that fits over the hearing aid and can reduce moisture from getting into the hearing aids. Some very active children, even older children, may use a retention clip, especially when they're outdoors, to reduce the chance of the hearing aid or cochlear implant falling off and getting lost in the grass or a field. So I think the first step is education, and the second is making sure that you have at least one, if not two, of everything that goes with the child.
And just to kind of go off of what Anita was saying, it's sometimes things that you don't even think about. So maybe a spare set of ear molds if it's sleepaway camp, because if an ear mold gets lost, you can't easily replace it. Or the tubing that goes in the ear molds, because that can easily be switched if something happens to it or debris gets into it, and we can even walk you through that, or your audiologist could. The other thing to think about, and quite often we see parents who will use a label maker or a sticker and put the child's name and a phone number on the inside of the hearing aid or the cochlear implant, so that if it does come off as they're running around, or they take it off because they're going to go swimming, that someone finds it, they'll see it labeled and can call. One of the things Anita and I both usually suggest is that you get a little pencil case and make a little case for the child that has everything in it. So it's all in one space, and that child can be responsible for it in their cabin, in their cubby, wherever it's being kept.
Those are great ideas. I love the idea of the phone number. I think I'm going to put it in my kids' thing to try to cut down on, maybe not cut down on losing them, but increase getting anything back. So I think that's a really great tip. So thank you, both of you. Sandra, a question came in that I think would be great for you to try to address. And the question is, my child has a hearing loss and is fine at school. I'm not sure what fine means, but is fine at school, but is acting out a lot at home. How can we handle that? What should we do?
Yeah, that's a really great question. And I really like what you said, Lori. What does fine mean? I'm not really sure what fine means, This is really, I'm just going to turn my air conditioner off. This is really, it's important, this kind of question really deserves a lot of discussion with the parents. But I can talk kind of generally about my perspective on this is that acting out is a behavior And this behavior is always some form of communication. So, you know, when kids are acting out, it's because they don't, well, it could be for a number of reasons, but generally it's because they don't have the words, they don't have the language to express what is really going on for them. And so they're showing what's going on for them. They're showing that they're having some kind of problem, frustration, irritation. And so I would say, if, you know, an important thing is to be able to shift our ideas about acting out, and what that is. It's not that the kid just wants to have a temper tantrum. It's that they are so frustrated that they cannot get out. They can't communicate what is really wrong. So I would say that would be the first thing to do, is to shift our thinking about what acting out is and understand it really as communication. With that in mind, effective tools, if you will, for intervening in acting out is to pay attention to what the behaviors are. Oh, I noticed that you're really yelling right now. I wonder if you're really feeling angry or if you're really feeling upset. Help the child by labeling feelings and commenting specifically on behaviors that you see. Understand that all of us act out, right? Oh my goodness, you know, you're driving down the street and the person ahead of you is not driving fast enough, and then we might start yelling. That's an adult acting out. So it's not just kids that act out, adults act out too. And if you think about yourself when you've acted out, it's during times of frustration and feeling angry and not having words for it, how you're feeling. Also, you know, in school, when you're saying like, oh, my kid is fine in school, but when they come home, there's an issue, you know, those are two very different environments, right? In school, kids are very structured. They follow the rules of the teachers, and the teachers are an authority, and there's more structure there. So kids are more likely to follow the rules. When they get home, it's mom, it's their parents, right? So they don't have to listen to what their parents say necessarily. They're around their parents all the time. Maybe there's, you know, they're acting out at home because of something that's happening at school. So it's important to pay attention to, you know, what is happening just before they're acting out. Is it every time they get off the bus, then they are acting out? Maybe something's happening on the bus. Is it just before they go to bed that they're acting out? Maybe there's something that happened just before that, or maybe it's in anticipation of going to school. So you kind of have to act like a little bit of a detective in a way and try and figure out, if I were in my kid's shoes, what might have happened just before this? What might I be thinking about happening after this? To try and, you know, help the kid, your child also figure out what's going on.
I think those are really great points. And yes, I think we've all acted out a lot this year, probably too. And I also wonder what you think. You know, we're getting this question this year. I'm sure that this is a question parents could ask any year, but the last 15 months have been difficult for almost every child, certainly in New York, if not the country, in school. You know, and I wonder, you know, if you feel like you're seeing a lot more of this, you know, from kids, you know, after, you know, school has been so difficult for so many of them.
Oh my goodness, school has been so difficult. You know, I'm seeing a lot more of isolation. Kids not wanting to go, you know, having online school and then not wanting to go back into in-person school. You know, it really has been a long time, right? It's been like a year and a half. A lot, you know, kids are changing so much. You can imagine they were 7 years old, they were 8 years old. Now they're 8 and 9 years old. I mean, that's a lot of changes happening for all kids, elementary, middle school, high school. So I'm really hearing a lot more of kids not necessarily wanting to go back, but then also, you know, more feeling sad and feeling lonely also, kind of, you know, the opposite of that. I don't know, does that answer your question? I'm not really sure if that's
It
answering your
answered
question.
mine. I mean,
Okay.
yeah, it answered mine. I know you answered the person who put it in. I think you did mine too. So thank you.
Okay.
That's great. The next question I think we have would be good for Elizabeth and Dana. It's a question that I know a lot of families, ask, particularly I think in the New York area. And the question is, can a child with a hearing loss learn 2 languages at the same time? Our family is bilingual. How should we do that? If you think we can, how should we go about this? I don't know, Elizabeth, do you want to answer that first from a speech pathologist point of view?
Yes, of course. Excellent question, by the way. As long as your child is amplified with a hearing device and can hear all sounds in any language, then yes, of course, we completely 100% support learning even more than 2 languages. And we encourage that you teach your child their language in the home languages. The 2 major points that I tend to like to make is that 1, the younger the better. So an infant, their brains are like sponges and they can absorb so much. So, certainly sooner the better. And also, as we know, as we get older, it's much harder to learn a second language. So we don't encourage you to wait. And as most of us can attest to, trying to learn a second language later in life, it's very difficult. The second point that we like to make is that you only teach a language to a child if you are fluent in that language. We want the model to be complete. We want you to be able to completely give them all the aspects of that language for them to learn it correctly and use it in the future. So let's say if parent number 1 speaks fluent Spanish, then they should be talking to the child in Spanish. Whereas if parent number 2 speaks fluent English, then they should be giving them the English language model. And in fact, we discourage trying to teach only 1 language if that parent is not fluent in it, because then they would basically be providing an incomplete model for that child to be successful in the future. Dana, would you like to add your input to that?
Yeah, those are all great points. I feel like we've had conversations in the past, like how many different languages do the children that we work with speak? Because it's often just a new language is presented to us, and we encourage it, especially because if your child is going to be exposed to extended family members that speak that other language, we wouldn't want the child to feel isolated when they're put in that situation. So if your family goes to Italy every summer because half of your family is Italian, then we don't want the child that entire summer to not be able to participate in conversation and interact with their cousins or their aunts and uncles. So absolutely, it's easier to start learning a second language right from the beginning. And it really gives children the sense of just feeling like they can participate and be involved in conversations around them, no matter what language they're surrounded by.
Yeah, that's great. I think that, I know that the old school used to be that when kids with normal hearing are learning 2 languages at the same time, it's possible that they could start out being a little bit delayed in both, but will catch up. Is that something that you might expect to see also with kids with hearing loss? And should parents worry if they see that?
There are times educationally that I'll see, just grammar structure when they're working on writing skills, that if it is a bilingual child, I'll see it really, impacting their early stages of writing development. We work with children for academic support at our office, and that's usually where I see it's, we have to kind of determine, is it due to the hearing loss or is it because there are 2 languages at home? And so that'll be a conversation, that we'll have with the team. But I would say, that's probably impacted for any child that's speaking 2 languages at home. So that's usually ways to be more of the piece, especially when I'm looking at a child's writing. Elizabeth, what do you see?
Yeah, I agree with you 100% that we should treat them just like a typically developing child with normal hearing in that aspect. So if there are some delays, there are ways that we can test and analyze what we are seeing in their language to see if that is related to learning a second language, because there are some trends in that department, but not to worry that because they have a hearing loss that they couldn't learn it completely and fluently in the future.
And I do have to say, Lori, you had made the point that previously it was always said, focus on one language, and that we often have families that say, oh, I looked online and it says for a child with hearing loss, only focus on that one language. And that really is research that's been proven otherwise. And, for those children of that age, that generation that really did focus just on one language, when they did get to high school or when their family did start to, travel to their families, it was much harder for them later to learn that other language. So again, if there are native speakers of that other language at home, we encourage you to be exposing the children.
Great. And I know that you both work with kids that speak multiple languages and everything is going pretty well with them. So your advice is really well taken. Better than we would do for sure. I have no doubt about that. Okay, thanks a lot. Jane, there's a question came in. It would be great if we had an ENT on, but we don't. But I know that you have experience dealing with kids that don't really want you to put things in their ears and fidgety kids. And one parent, and my heart goes out to them because I know how hard it must be, said that my child needs to be examined by an ENT periodically, and they're very fidgety and they really can't get it done. Are there any tips or tricks that you can offer to help? And I know that you have tricks up your sleeve for the things you need to do. So is there any tips you could give the parent?
Oh, yeah, that's a great question. In fact, just a couple hours ago, I had a kid who had a hard time with one of the tests we do called tympanometry to measure the middle ear, where we have to put a little rubber tip in the outside of the ear, and it really doesn't hurt, but it can be really scary. So what we did, we played videos. We had the mom's phone with one of his favorite videos on. We sang songs. we still kind of had to, kind of prevent him from pulling it out. But distraction techniques are a big one. If the family knows there's an appointment coming up and what's going to happen, they can also help prepare the child. So if they're going to have to, like in our case, wear headphones or have something put in their ear, or going to an ENT, have a little light shining in their ear, then they can kind of act and prepare the child by, mommy can do it to daddy, and then daddy can look in the child's ear, and it just helps to alleviate the anxiety and, when the child knows what's coming.
Mm-hmm. Great. Those are good tips. And it occurs to me as well, to this parent, that the parent could, I'm assuming it, but maybe make sure that the parent is bringing the child, if it's possible, to a pediatric ENT who, same as a pediatric audiologist, is much more comfortable working with children, who need to be convinced to cooperate. And while many general ENTs can, a pediatric ENT might be better. So if you're not seeing, that might be, I guess a point as well. Okay, thanks very much for that. Before we get to the next question, I was just alerted, a shout out. We have a parent listening from Panama, which is probably the furthest away we've had for a while. So just a shout out to you. Welcome. We're glad that you're joining us. And if anybody else is joining from far away, let us know and we'll give you a shout out as well. Next question, Anita, I'd like you to take the next question that came in. I know you have a lot of experience with this. A parent wrote in, my child is 10 months old and has microtia atresia and wants to know about just, I guess, general kind of guidance on maybe the first steps to do or what they should anticipate down the road. And I know you've worked with many, many families in this situation.
Well, like any child who's been diagnosed with hearing loss, I think there's a number of different roads that the parents walk down. For a child who has microtia atresia, which means that there's a structural difference with the outer ear, possibly the middle ear, and possibly the inner ear. And we sometimes can't see that up front, but we do see externally a difference in the formation of the outer ear. The child really needs to be evaluated by a pediatric ENT, just as you mentioned before in the previous question, because the pediatric ENT is going to discuss the medical management of that child. For a child who has microtia atresia, whether or not it's in one ear or two ears, there will still be an impact on how the child is going to learn to listen. And it's very different when you have a hearing loss that's unilateral or bilateral, but the impacts sometimes overlap. listening to certain sounds, listening in certain situations, listening when it's a unilateral hearing loss from sounds that are coming from different directions can all be challenging. So a child with this diagnosis is managed in a similar fashion. The child would benefit from a form of amplification. Typically, a child with microtia atresia would use a device that's called a bone conduction hearing aid. It may be fit on one side if it's a unilateral hearing loss, and it may be fit on both sides if it's a bilateral hearing loss. And this child will also benefit from working with speech and hearing therapists to develop their listening skills. And as the child gets older, their ENT will make further recommendations in terms of the medical management. As a child gets older, there may be surgical options available that can address either the cosmetic impact or the restorative impact of hearing. So I think ENT, audiologist, speech pathologist, and whoever else may be of benefit, and the whole team will really guide those parents successfully.
That's great. Thank you. Thank you. And then another question, this one came in actually even before we started. Anita, you should stay up. You stay up because this would be good. You could come back, Anita, Jane, and Sandra. I think this would be a good question for you from a lot of different perspectives, and Sandra too, if you heard me. Okay, great. A question came in about hearing fatigue, and the parent asked, how true is hearing fatigue? What is it? And should we really insist that our kids wear the hearing aid, even if we think they're experiencing fatigue? So, I know that when we sometimes as audiologists are very quick to say, you have to wear a hearing aid all the time. Mm-hmm. And yes, kind of you do. But what is a parent supposed to do? So I don't know, Jane, maybe do you want to address that first, what that really is, or how you see it? And then maybe Anita could add from audiology, and Sandra, then, there's lots of emotions I could hear in that question.
Mm-hmm. Yeah. And one thing to think about is it is really stressful to try to listen and understand when the signal is not clear. So if it's distorted, or if there's background noise, or, if pieces of speech are missing. And for that reason, the hearing aids should be well fitted. Perhaps some algorithms having to address noise reduction might be appropriate. Perhaps some use of remote microphone or FM technology might be useful to reduce listening fatigue. But in the end, if the child is engaged in an activity that doesn't require listening, at the end of the day, perhaps reading, doing homework, then it might be appropriate for them to take a listening break, because we do hear from adults who wear hearing aids that, sometimes I just want to shut off. So yeah, well-fitted hearing aids should reduce listening stress and fatigue, but you know your child best.
If I could add one additional point, I think we all work hard to listen in certain situations. And I think for this particular parent, I think it's probably a benefit to try and explore what's happening to potentially cause the listening fatigue. Mm. Is it stress? Is it distractibility? Is this happening only in school? Is this happening only at home? And I think really taking that team approach by getting information from the teacher, the speech and hearing therapists, maybe bringing in a psychologist like Sandra to be able to answer or help answer the questions as to why we see the behaviors that are being seen. And maybe there's other factors, maybe it's not just that the child is not, is tired because they're not hearing easily. Maybe there's something else happening in the classroom. Maybe they're not seated in the best seat in the classroom and they're far away, or their FM system isn't working. Or perhaps they're not seeing the blackboard or the electronic board clearly. Is their vision good? There's so many things that are going on. So we shouldn't just automatically assume it's because they're having trouble hearing. Mm-hmm. We should also kind of take that whole child approach and delve a little bit deeper to see what's going on. But as Jane said, making sure that they're hearing optimally with their hearing aids, making sure they're using an FM and a remote microphone in the classroom, or a parent using a remote microphone outside of school, just to make listening as easy as possible. And at least that's one thing that can be crossed off the list.
Anita, I think that's awesome what you're saying about taking the whole child approach. I couldn't agree more. Exactly what you're saying. Like I mean, the question was, I think part of the question was, is hearing fatigue a real thing? And I would say it absolutely is a real thing. That being said, exactly what you're saying, Anita, you have to look at the whole situation. Like, what is going on here? Is this listening fatigue, or is this, I don't want to wear my hearing aids because of any number of reasons? So I think, it's just really important to take that into consideration. When it is actually really hearing fatigue, I completely think it's very important to allow for breaks, just like you were saying, Jane. Also, like, adults need to take hearing breaks. Adults who don't wear hearing aids need to take hearing breaks. But it's really important to allow the child to be able to take a hearing break for a number of different reasons. But also, if you remember from high school psychology, classical conditioning, right? If kids are like forced to wear hearing aids, they can get a negative association to wearing hearing aids, and then they want to wear them even less, right? Oh, I don't want to wear that hearing aid. It hurts my ears, or it gives me a headache, or whatever the negative experience is. And we don't want that, right? We want kids to be wearing their devices that are helpful for them. So that's, just keeping that in mind also. It's, when it really is listening fatigue, then yes, absolutely. They need to be provided with, they need to be able to take a break. Yeah.
Really good. I want to call up Dana while you guys are still up here. Also, Dana, to see if there's anything you could add from the teacher's perspective, or something that, something maybe that you think could be done that could help try to figure out, what is going on, and is there any way to make it better?
Absolutely. And those are all really important points. And I like what Sandra had said a few questions ago, is it sometimes takes detective work to really figure out what it is that's going on. And in this situation, I'll often go into the classroom and do an observation and see, if the listening fatigue is happening at school, that's where I'm able to assist to say, watch a child at different parts of the school day to see maybe it's the air conditioning unit that's really impacting their hearing. So by the end of that class, their body is, all, down on the front desk because they're just so tired from trying to listen over the air conditioning unit. Or maybe it's that all of their academic classes take place right in the morning. So by the time the afternoon comes, they're so tired because they just spent 3 straight hours in reading, math, science. And so I'm able to talk to teachers about ways to help kind of spreading out the listening that the child is doing. And at school, we really want children to keep their equipment in all day. They take their equipment out, the equipment could get lost. They may give their teacher a hard time about putting it back in. But instead we could say, okay, when you notice that the child is slouching in their chair, maybe that's a good time to ask the child to run an errand for you, to say like, oh, could you bring this to the teacher across the hall? Because I need more Post-it notes from the teacher across the hall. Can you go get some for me? And that really gives children the opportunity to just kind of regroup and walk away from kind of the auditory impact of just listening to a speaker straight through, and it gives them a break. They get to stand up, they may stop and get water, and then they sit back down. So if you're hearing or you're noticing that the listening fatigue is happening at school, definitely consult with a teacher of the deaf that you may work with, or at CHC, we go out and do these school visits and see if somebody can observe your child at school. Everything that you guys said in terms of after school is very true as well. And sometimes at the end of a school day, parents want to do after school activities right away, so they sign up for the after school activities at the school. And sometimes it's helpful if the children, you pick them up, they go for ice cream, they get a snack, and then you drop them off at an after school activity. It gives them a little bit of break from not needing to go right from school to the activity. So some of those accommodations can be made to help your child through the day.
Those are all great, really, really, really great and helpful tips. So thank you all. Thanks about that. I want to bring up, I think for this question, I think Camille and Michelle, can ask a question that could probably be a webinar all by itself, but I'm sure you'll be able to take care of it in a few minutes. So a parent wrote in that my daughter has been wearing hearing aids since she was 4 months old. So that's good. And she's now 5 years old and is being evaluated for a cochlear implant. Can you give me some feedback about the procedure? I guess maybe what the process is, what to expect. Maybe, or maybe Michelle, you want to start, it kind of starts with audiology-ish. And I know this could be an hour webinar by itself, and maybe we'll do that down the road if people want it. So what you can in a couple of minutes.
Sure. So typically when your child is being sent for a cochlear implant evaluation, it means that somewhere your child has been evaluated with their own hearing aids, and it's finding that the hearing aids are not sufficient, that the hearing aids are not providing enough sound and enough adequate amplification for your child to really learn speech and language well. And it's important that all that sound gets in while language is being developed. So if we've hit this point that you're already at the cochlear implant evaluation, typically what will happen is at a cochlear implant center, your child will be evaluated by a cochlear implant surgeon or an otologist or ear doctor, who will talk to you about if a CAT scan or MRI is needed, the hearing loss, what they feel the benefit might be from a cochlear implant. But you'll also meet with a cochlear implant audiologist, who typically will test your child with their own hearing aids, or if they feel there are stronger hearing aids or more optimal hearing aids, they'll be tested. And they will also talk with you about the different cochlear implant companies, demonstrate the different cochlear implant devices, so that you are part of the choice of what your child would receive if surgery does occur. The other thing that typically happens at cochlear implant centers is that they will have a speech and language evaluation. And often parents say, well, my child's been getting speech therapy all along, right, Camille? And I know what my child's doing in speech, but a center still wants to have a pre-implant evaluation to have some information. It's always good to tell the cochlear implant center audiologist and speech therapist who's doing the evaluations to contact their current audiologist, contact their current speech therapist, because often we can provide information that may not be able to be obtained in just one visit or in just a couple of visits. And then once all that's done, there is the determination of if your child is a cochlear implant candidate, what device they would get, and the surgery is set. But it's really important to make sure it's a team approach and they are talking with their current audiologist and speech therapist.
That's great. And maybe, Camille, can you add, like, especially with a 5-year-old, what are the things that you think might make a child more likely to be an implant candidate or not? Or, what do you see from a speech pathologist point of view?
I would think that a lot of the decision about whether a child will receive a cochlear implant is going to revolve around whether they can perceive speech in its entirety. And there are specific guidelines about how poorly your child will need to do on a hearing test, which would include speech perception scores. So how well they can repeat a word back in an audiologist booth in that sound controlled environment. And that will really make the determination about whether or not audiologically they are a candidate. I'm not sure I have much more to add to what Michelle said. She was very thorough and complete. I thank you for that, Michelle.
That's good. It's probably a little bit easier to be second than to be first. So if I bring the two of you back up again, Camille, you're going to get to go first. Michelle will get to take a little bit of a break. So
I just think it's very important to just remember that they really should talk to their current speech therapist, because we found even at the center, an audiologist gets a very small picture of the child, and the speech therapist sees them a little more ongoing, a little more often, and we'll contact and just find out information that really fills in on what we may not have seen.
Yeah. Especially for this question is about a 5-year-old. 5-year-olds can be chatty Cathy one day and very quiet and shy the following day, especially if it's with an unfamiliar person. And so the speech therapist who's been seeing your child for hopefully a long time probably will have the more complete information about how your child's doing developing speech and language than the one-time evaluation that will happen with a speech and language pathologist at the implant center.
Or the educator, don't forget the educator.
Or the educator, sorry, Dana.
And the teachers.
You know what? I mean, I think that that's just always an important point. It really, they say it takes a village. It really does take a team for kids with hearing loss, especially when you're making this kind of a decision. So those are really good points. So thank you very much. I want to call up now Dana and Elizabeth. We're getting one or two questions about IEP meetings. And I wanted to know, I mean, maybe Dana, you start on this one. Can you talk about how you specifically at CHC can help support families in the IEP process? Maybe I guess for the other parents that are on who may have younger children, explain maybe what an IEP is, and then how you can support them. And Elizabeth, then after that also, as a speech pathologist, what your role is in that process.
Absolutely. So when your child is aging out of early intervention, they then join the Department of Education. And so they go from having an IFSP to an IEP, which is an individual educational plan. And this is a team meeting. The team looks over evaluations that take place, and your child's current therapist may be the ones to be able to do the evaluation. You may go to another site, like a CHC is an evaluation site for preschool evaluations, and the child receives a psych ed evaluation, a speech and language evaluation, and then a parent interview. And all of that is brought together for an IEP meeting. And before any of those meetings take place, I meet with the parent and we talk about, what are your goals? What are things that you want to see? What are services that you'd like your child to reach? And then on that meeting, I act as a parent advocate to make sure that your concerns and your hopes are being heard by the team. And at that meeting, then the district will determine what services your child is eligible for. And that meeting takes place yearly. And then every 3 years, there's a triennial where new evaluations take place. And they reassess kind of how your child is doing in academically in their speech and language, or if your child has any other areas of need like OT and PT. And so throughout that process at each stage, I help families to see sometimes the child's receiving a lot of therapy, and as they get older, when's the right time to cut back on therapy? When is the right time to say, like, they're doing really well? And sometimes it's comfort for the parents. So sometimes we just need to give that encouragement, like, no, they're doing really well. It's okay to have a reduction. Or at times we say, we're really noticing that, they could use additional support, and let's increase the time that the child has with the teacher of the deaf at school. And maybe, they're visiting twice a week. Maybe it'd be helpful if 4 times a week they came in. And so throughout that entire process, I work with the families to make sure that the services are appropriate. But part of prepping for those meetings is really making sure that the team has a clear picture of your child's auditory needs related to their hearing loss. The school is going to look at things from one perspective, and we make sure that we're presenting all of the information so that the team that doesn't specialize in hearing loss that participates understands the impact of hearing loss. So we'll bring in audiological reports. I may go out and do a school visit and submit an observation report. Elizabeth can talk a little bit about a functional listening evaluation, but all of those pieces help the other members of the team from the district really understand that even though your child may score in the average, high average, superior range on some of these tests, there still is a need for support to help them continue to do well in school. And so by having that additional person part of the team that's really focusing on the hearing loss, it gives parents comfort to be able to trust the services that are agreed upon. But Elizabeth, I think it would be helpful just how a functional listening really can support the child.
Yes, of course. And I can definitely attest to Dana, being there for families. I've seen it countless times, her at the meetings, and getting children the support that they need and being that extra voice to, help get the child's goals met. So thank you, Dana. And as far as, what we do as SLPs, speech language pathologists who specialize in hearing loss, that's different than an average speech pathologist that would work in a school, is we really look at the child's functional listening abilities. So we do a functional listening assessment, and, we know offhand what the child's hearing loss is, how their amplification works before we even start the testing. the main aspects of a functional listening assessment is to, one, identify their strengths and their weaknesses in order to create their goals, and then two, it's to monitor their progress over time. And you know, we look at things very differently because we're looking at how the child hears sounds, to how they discriminate sounds from other sounds, to how they identify these sounds in words, up to how they understand words to increase their vocabulary. And that's all at looking how they perceive sounds at the word level. As the child gets older, we then look at how they are perceiving sentences, directions, following directions, how they are understanding paragraphs and stories. And we also go in depth and analyze how they are perceiving these sentences and paragraphs when they do have a visual component of the speaker's lips, and then compare that to how they hear sentences when they're in a quiet environment. So we cover our mouths so they can't see what we are saying, but see how they perceive it just by listening only in a quiet environment. We also test them with our mouths covered and with some additional background noise in the background, which is most typical of a classroom with children speaking in the background or noise outside the window. And we test them at that level. We go as far as looking at how they listen with just their right hearing device or their left hearing device. You know, unfortunately, if at some point one side goes out while they're in school, are they still going to be able to function with the one side? And then even beyond that, we look at how they're listening to recorded voices. You know, so oftentimes in classrooms, they watch videos and they listen to different things that are not a live speaking voice, and we analyze how they do it at all those levels, and then give the feedback to the schools on how they can create their goals and support them in the classroom.
I've often been on IEP meetings where a district may say, oh, your child doesn't qualify, they're doing well based on the psych ed eval and the school speech evaluation. And then I pull out one of these functional listening evals, and the child, they then qualify for an IEP based on what I'm able to show from this functional listening. It's really, it helps to show a greater picture of how they're hearing in the context of a classroom. So it's important, do your research, get outside evaluations that are able to support your child's needs, and just know your rights as a parent. And I think making sure that you feel comfortable going into the meeting with all of the kind of support that you've put together for your child.
Great advice. Thank you. I want to call up now. We have time for one last question. I want to call up Dana. You could stay because I'm going to call you up again anyway. Camille, Michelle, and Sandra, would you join Dana? And we only have about maybe like another 5 or 6 minutes. We don't want to keep people too much later than we said. And the question, you know, that came in, and that I know we hear a lot. We pride ourselves in being multidisciplinary. How do therapists in different areas, different disciplines, really all work together to support a child and a family with hearing loss? And I know you could probably each, would it make it a little difficult for you? You could probably each do about half an hour on this one. So if you could each do like maybe a minute or so on each, you know, I don't know, we're talking about, you know, maybe supporting, maybe, you know, Sandra, maybe you want to, you know, take it first and talk about, you know, really like just, you know, in general, how do you work with everybody else to help support the family?
Yeah, no, I think that's a really great question. I think that's something that we do very well at CHC. How do we work how do I work with, you know, how do we work together as a team? I'm really there, you know, to provide consultation. I can say like within the last couple months, I've had, you know, referrals, just parents just want to have a consultation, just to talk about an issue that they have with their child and to get some kind of support. And, you know, that's one of the reasons that I'm there. You know, it's a very seamless and very easy referral. You know, the speech pathologist, Camille, might just contact me and say, hey, look, let me introduce you to this parent. She's having this issue with her child. Can you talk with her? And it's very easy. And so definitely as a consult. And also I also provide play therapy for kids. If kids really are having a difficult time, I'm a play therapist, so I work with them directly too.
Great. And, maybe Michelle and then Camille, audiology and speech, how do you guys work together to help?
Sure. One of the things that I have found really helpful as well is not only that someone can provide consult or more information, like we were saying before, that it's a team approach and we really can get more than just the small amount that the audiologist sees the child. But I know I can go to Sandra and say, this is the concern the parent has. This is the behavior they're reporting to me. Where do you think I should send them? What do you think I should do from your perspective, from your scope of practice? Because to me, it's not really the ears or the hearing aid, but something else is happening. Do they need a developmental evaluation? Should they see you? Do they need a better speech evaluation? And so having that source is really great. The other thing that I think sometimes, and we brought this up about cochlear implant too, is when we're wondering if a child is doing well enough with their hearing aids, it's wonderful to be able to say to their speech therapist or to go to Dana and say, listen, this is the concern that the parent is seeing, but when I test them in a booth, they're kind of getting by, they're doing well. I'm not noticing anything. Can you tell me what's happening in school? Can you tell me what's happening in speech sessions so that we get a better full picture of what's going on with the child?
Great. Camille, you want to just maybe add to that? And then Dana, you could kind of close it up with another sort of whole general, I think someone said whole child approach, kind of.
Oh, yeah.
Or teacher and psychologist sort of get that. I think.
This, for me, I'm looking at the screen in front of me and thinking this week I have consulted every one of the colleagues in front of me for one reason or another, and I do feel like I kind of dabble in everybody else's profession. A little psychology, a little hearing testing, and I'm always up in what's going on at school. And so I do feel like I have my hand in all of those things, but I'm certainly not the expert. So when I get it in over my head, if there's a child exhibiting a challenging behavior, I might go to Sandra and say, help me. I don't think I have the skills to manage this, and I have to still accomplish X, Y, and Z. Or I'm trying to get this child to say this word or this sound, and I can't. Michelle, is there maybe something more you can do with the hearing aids? And then lastly, but certainly not least, this child is exhibiting these challenges in therapy, and I'm worried they're doing this, they're having this trouble at school. Dana, how can you help that child at school? How can we support this kid a little bit better? I don't want them to struggle quite so much. So certainly this is something we could talk about for an hour, I'm sure, but I think it's one of those things that makes CHC so special, is that we do kind of all dabble in everybody's business to the benefit, I think, of our clients. And so it's a great place to work, and I think it's a great place for kids to come for that reason.
Well, I definitely agree with that one for sure.
All right, not to plug
but no, that's okay. But Dana, I have an interesting question and maybe a good way to wrap it up. So there are a lot of kids that in New York have teachers of the deaf. They're not you. They're not a CHC. They have a teacher of the deaf. They have an audiologist. They have a speech pathologist. What would you say to those parents? I mean, if there's something like, if it's not a team working together, then what would you advise a parent to have the teacher of the deaf maybe do? What kind of information could they get? Should they get from the audiologist and the speech pathologist? How would you pull it all together? If you don't have a team all together, is there, anything you could tell them?
Absolutely.
In a minute.
In 1 minute. That 7 hours that a child's at school, that's really a question mark on, the entire team's outlook on the child. They want to know what's happening in the classroom. And so I recommend that parents ask their TOD in a classroom to say, I'm really looking that you, be my child's kind of advocate and lifeline to the rest of their team. So when you notice something at school, I'm asking that you make sure to let me know, or let the child's audiologist know that you're noticing they're more fatigued through the day, or they're having a harder time hearing, in this setting. And if you're noticing that the child's having a really difficult time with new vocabulary, let me know so I can let the speech therapist know. So really kind of putting that responsibility on the teacher, that's their role. Their role is to be the eyes into what's happening in the school day. So kind of build that relationship with the teacher of the deaf that's in the classroom, and create, if you can't have this full team approach, help create that with the therapist that your child does work with, and kind of give that, give everybody what you'd like their job to be, and you need one person to be that main outlook and source things out the way that they see fit.
That's great. Great. Thank you. And yeah, and it really could be a whole webinar by itself. So maybe I just ask everybody, that's all the time that we have for tonight. If everybody, maybe a panelist wants to put their picture on so everybody could see you all one last time. And I thank all of our panelists. I thank all of the people who are attendees for coming and hearing from our pediatric team. If you have any questions or want to connect with any of the professionals here, we're happy to help facilitate that. Please contact our Family Resource Center coordinator, who is Dana Selznick, our teacher. Her contact information is in the chat and also on our final slide. You could reach out to her and say, you know, I really want to talk to Jane because I don't know how to help my fidgety kid. And we'll be able to put you in touch with whoever you're interested in. So thank you all for participating and being here, and have a good night.